Hello dear student, in previous class I have explained about the individual and brief introduction and brief mechanism of action about bronchodilator drugs. In that bronchodilator drug we have studied about beta-2 cholinergic drugs, anticholinergic drugs, beta-2 sympathomimetic drugs, misalzentine, about their mechanism of action and the dose that is required to take to show its anti-asthmatic action. And as I have told you that in today's class we are going to discuss about the other classifications of asthma a drug and going to explain about their mechanism of action, their dose and how we have to take it and how the drug is going to show its action as an anti-asthmatic drug. So let's go into the video. So first going to explain you about the second classification or second type of anti-asthmatic drug, that was leukotrienes inhibitors. Leukotrienes inhibitors. About all that classification, one line I have discussed you in previous go and check it into the last video. That link I have already given into the description. So let's go into the today's topic, that is first or second classification of drug after bronchodilator, that was leukotrienes inhibitors drug. We are going to study about the example first. What is the examples? That are montelukast and zephylleucast. Both have same type of mechanism of action and same type of dose. So I will go to explain you about the mechanism of action of montelukast and how it is going to show its montelukast as an anti-asthmatic drug. It is going to show its action by name only you can understand it will inhibit the secretion of leukotrienes. For that you have to remember one thing: when any allergic reaction or injury happens to our body, what it will take? For that our body is started to form arachidonic acid. When our body is going to show that arachidonic acid generally divided into two parts, that is COX and another one is LOX. Here we want LOX part because LOX it generally show bronchoconstriction. So to anti-asthmatic drug you have to inhibit the action or synthesis of that lipooxygen. That arachidonic acid generally convert into the LOX by the action of 5 lipooxygenase enzyme, and due to the help of 5 lipooxygenase enzyme, that arachidonic acid is formed LOX, and in that LOX also different types are there. In that also different types are there. That was ATC4, LTD4 and LTE4. So now to show the anti-asthmatic action, that drug is have to hit the action of all that receptors that is related to leukotrienes. So how montelukast is going to show its action? Montelukast is going to show its action by inhibiting the formation of LOX or lipooxygenase from arachidonic acid. Due to the prevention of LOX, it is going to decrease the formation of LTC4, D4 and LTE4 action, and due to the inhibition of all these receptors, it is going to show the decreased level of cytosolic leukotrienes. So due to the decreased amount of cytosolic leukotrienes in cytosol, it is going to show bronchoconstriction. Due to the bronchoconstriction, it will show bronchial secretion. and by showing the secretion, it is going to show the action of anti-asthmatic drug, and by this only leukotrienes or montelukast, they generally inhibit the formulation of leukotrienes, and then it will go to decrease the release of inflammatory mediators, and due to the decrease in release of IM or inflammatory mediators, it is going to bronchoconstriction, and that will lead to the extra release or excess release of bronchial secretion, and by that it is going to show its anti-asthmatic reaction and it will treat asthma. Now we have to tell about the dose. What is the dose? It is also dependent upon who is taking the drug. In case of child it is different, in case of adult it is different. In case of child, we have to take the drug of 4 to 5 mg per day, but in case of adult we have to take 10 to 15 mg per day. So depending upon the age of the patient, you have to take the amount of drug. For children you should take 4 to 5 mg per day, and for adult person the dose should be extended or increased to 10 to 15 milligram per day. ঠিক আছে, আমি পরে কেটে দেবো, তুই চাপ দিচ্ছ। By that I about the classification second class of anti-asthmatic drug, that was leukotriene inhibitors. Then I discussed about their mechanism of action. Now we are going to discuss about the third type or third classification of anti-asthmatic drug, that mast cell stabilizer. Mast cell stabilizer. I have told you about the mast cell stabilizer in previous class only. What is the example of mast cell stabilizer? The example of mast cell stabilizer is যেটা আবার কাটতে হবে না কেটে দেবো সব। সোডিয়াম ক্রোম লাইকেট, তো বড় নামটা শুধুই ভুলে যায়। Now I am going to explain about the mechanism of action about the third type of anti-asthmatic drug, that is mast cell stabilizer. And in that example I have already told you in previous class, that is sodium chrome glycate. So that is the main drug that is generally used as mast cell stabilizer asthma, because it is having anti-asthmatic property. And now we will study how that is going to show its action. How it is going to show its action? When it is taking, when it is passing through the cell membrane, it will increase the influx of Ca2 plus. That means the entry of Ca2 plus, it will going to increase. So it is going to increase the plus influx. Due to that Ca2 plus influx, it is going to prevent degranulation. Due to that decrease in muscle degranulation, that will lead to the release or no release of inflammatory mediators like prostaglandins, interleukins, cytokinins, and leads to the bronchoconstriction, and that bronchoconstriction is going to lead the release of bronchial secretion, and by increasing the bronchial secretion that sodium chrome glycate is going to show its action as an anti-asthmatic drug. So now we will study about the dose what we have to take to treat asthma of sodium chrome glycate. What is the dose? The dose should be 20 mg per daily dose, and you have to take it 4 times in a day. That means after 6 weeks 4 times you have to take that drug, and that dose should be 40 mg in per dose. Means first time 20 mg, second time 20 mg, third time 20 mg, fourth time 20 mg, like that 4 times you have to take in one day in the gap of 6 hours, so that sodium chrome glycate can show its action as an anti-asthmatic drug and can treat asthma. Now we are going to treat asthma by taking fourth type of drug or fourth class of drug, that was anti-immunoglobulin E therapy or E drug. What is the example of that? That is omalizumab. That is the example. Now we are going to see what is the mechanism of that type of drug or anti-IG drug. First of all, during the study of asthma is a autoimmune disease, because sometimes against the foreign body or antigen our body immunity is going to show extra possession, and due to that extra possessiveness that immunity is going to show over excitation or hypersensitivity reaction that can lead to the bronchial asthma. So in this therapy what we are going to generally do? We are going to generally do inhibiting the action of immunoglobulin E, and by decreasing the action of immunoglobulin E, it is going to decrease or suppress the immunity of our body, so that immunity of our body can't show extra possessiveness or antigen action, and going to show autoimmunity that can lead to asthma. So due to the decrease of IgE, it will going to decrease the immunity system of our body, that will lead to the treatment of asthma. Now we will study how it is going to show. You have to remember that omalizumab is a monoclonal antibody. That is going to show its action by binding with the FC region of FC region of IgE. Now by binding with the FC region of IgE, it is going to show its action. How it is going to show its action? By binding and forming a complex with IgE or immunoglobulin E, it is decrease or it is inhibit the binding of IgE. It will going to inhibit the binding of IgE with its receptor. Due to the inhibition of binding with receptor, it is going to show the sensitivity of IgE against antigen. So due to that less sensitivity against IgE against the antigen, it is going to show suppression in immunity, so that IgE can't show its action against that antigen. And when that IgE is going to fail to show its action against antigen, our immunity body or immunity generally becomes suppressed, and due to that bronchial muscle can't be constrict that regularly, and it will lead to the degranulation of mast cell. and due to the degranulation of mast cell, it is going to show its action and also decreasing the synthesis of inflammatory mediators and action of suppressing immunity than by degranulation of mast cell, and also by inhibiting the release of intra-inflammatory mediators that omalizumab is going to show its action as an anti-IgE drug, that is going to show its action as anti-asthmatic drug to treat asthma. Sorry. And dose. Now we'll study about the dose of omalizumab. What is its 75 to 375 injection that we have to take subcutaneous. So the dose should be 75 to 370 mg per ml, and that should be taken subcutaneously. So that is how that omalizumab is going to show its action as an anti-asthmatic drug. কতক্ষণ হয়েছে রে? এর মধ্যে কতক্ষণ হচ্ছে বল, এর মধ্যে 5-7 মিনিট বাদই তো যাবে।
16 মিনিট তো মিনিটের ভিডিও হয়েছে,
এখনো বাকি আছে। বন্ধ করে দিয়েছিল, বন্ধ করিস নি? Now I am going to explain about the last and final classification of anti-asthmatic drug, that was glucocorticoids. In first class, when I have described about the classification of anti-asthmatic drug, there I have told you glucocorticoids also is classified into two subclass. That is the drug we generally have to take systematically, like by oral tablets or injection, and the second type of glucocorticoids, that is inhale. That means by that or inhaler we have to take that. And what was the example of that? For systematic, the example was hydrocortisone or prednisolone, and for that inhalation glucocorticoid, the example was pyrrolizine. That beclomethasone is also used in regular inhaler, generally asthma patient use in their daily life as inhaler. And both these two types of drugs, they are having same mechanism of action, but due to their different mode of administration, they are classified into two, systemic and inhalation. In systemic, example was hydrocortisone and prednisolone. In inhalation, the example was beclomethasone. So I am going to discuss about the mechanism of action of glucocorticoids by taking hydrocortisone as a standard drug, because I've told you both type of drugs shows same type of mechanism of action, but their mode of administration is just different. So what is the mechanism of hydrocortisone? You have to remember that hydrocortisone, when we are taking, that is going to pass the cell membrane, and when it is passing through the cell membrane, it is going to bind with a receptor that is already present into the cell, that it will form that hydrocortisone plus receptor complex. Due to that formulation of complex, it will lead to the alteration of transcription or gene transcription. So by binding with a receptor and forming receptor complex, it is going to alter the gene transcription, and due to that alteration of gene transcription, it is going to decrease the release of interleukin 5 and also the release of TNF alpha, and due to release of all these inflammatory mediators become decreased, and due to all that inflammatory media's decreased release, it is going to show bronchial construction and by muscle inflammation. Due to that decreased bronchial construction, bronchial secretion, and in decrease in muscle inflammation, it is going to show its action as an anti-asthmatic drug, and it generally can also show its action by inhibiting the action of phospholipase C. So for that combination of this type of mechanism, like decrease in formulation of IL-1, IL-5, THF alpha, and also the decretion of phospholipase C enzyme, is going to lead to the decrease in bronchial construction, increase in bronchial secretion, and decrease in bronchial muscle inflammation. And by all that alternative and total combination of mechanism of action, that hydrocortisone is going to show its action as an anti-asthmatic drug. Now we are going to study about the dose, what we have to take in minimum quantity to avoid side effect and to show desirable anti-asthmatic property to treat asthma. That is 2 to 4 mg per day, but you have to take it into the food dose. So what is the amount you have to take? The amount is 2 to 240 mg per day, that you have to take in 2 to 4 dose per day. That means from first dose you have to take 20 to 240. In second dose also like that, 3 dose also like that, 4 dose. If you are taking more time, then the amount of dose will be less. If you are taking less time, then the amount should be more. So depending upon the dose, if you are taking 2 dose, then you have to take 240 mg per day. If you are taking 4 dose, that means you have to take 20 to 40 mg per day to treat asthma. So this was how the glucocorticoids, mainly hydrocortisone, that is generally used in our daily life mode to treat asthma, is going to show its action as an anti-asthmatic glucocorticoid drugs and going to treat asthma. So by that I have finished off the all classification of anti-asthma, and in today's video I have explained about the fourth classification of anti-asthmatic drug, excluding bronchodilator, that I have already discussed in the previous class. Today we have only discussed about the leukotriene inhibitors drug, then mast cell stabilizer drug, then anti-IgE drugs, and glucocorticoid drugs and their mechanism of action and dose, and so how that all drugs is going to show its action as an anti-asthmatic drug and going to treat asthma. So by that I have finished off the total portion of asthma and the drug used in asthma as an anti-asthmatic drug. Next class we are going to discuss about a new topic that I am going to explain next class. For today this is enough. Go and check all that video previously in first video where I have discussed about introduction of asthmatic drug and their classification. Then next class individual drug about bronchodilator, in that beta 2 sympathomimetic, then methylxanthine, then last one anticholinergic, and today's class we have discussed about leukotriene inhibitors, mast cell stabilizer, anti-AGE therapy drugs, and at last we have discussed about the glucocorticoids and their mechanism of action and dose. If you have any problem, you can ask me in the comment section. And all the part of asthma, the part 1 and part 2, I have already given the link into the description. Please go and check it out, that part 1 of asthma and part 2 of asthma, before going to see that video, so you can better understand all that remaining classification and their mechanism of action better that I have discussed in today's class. Thank you.